Sanket here. Welcome to the Pharmacokinetics lecture series. In the last lecture, we saw what exactly is pharmacokinetics and what are the various events which take place in the pharmacokinetics. We also saw what is drug concentration. Today, we'll be looking at what exactly is your liberation and absorption. So when we are talking about drug, it is very important to understand how does the administration of the drug actually take place, or how is the drug really administered. So there are various ways in which the drug administration can take place. One is by oral or by rectal. Okay, so that means you either take in the tablet, okay, through your mouth, which is your oral type of administration, which is the most common type of administration, or in some cases is through the rectum area. Then it is by percutaneous, which is nothing but your skin. Next is your intravenous. All right, intravenous is by an injection you directly give it in your blood vessels. Then it is intramuscular, that is you give it in the muscles. If you know the example of intramuscular, it is diabetes, okay, which is an intramuscular injection. Then there is intrathecal, that is to your CSF, that is your brain area, okay, which is given. And last is your inhalation, that is to the lungs. So mostly the pumps which is there. Now, oral and rectal is your gut, percutaneous is your skin. Now, all of these from here, so once the drug is administered through all these systems, they directly go into your plasma, okay, that is into your blood. It is in this plasma or the blood where the actual distribution starts taking place. All right, so this is nothing but your absorption stage here. All right, and from the absorption stage it is your distribution stage, that is in your plasma. In your intravenous, that is only an exception where directly your the drug is injected into your blood, and that is actually also the reason why injections which is given to your blood inside your blood vessel or inside your vein, they act very quickly, is because they are directly injected. These things, they have to go through a lot of passageway and then enter. So the time taken for these drugs to act, oral, percutaneous, intramuscular, intrathecal, is it takes a lot of time, but as intravenous it happens very fast because it is direct. After it gets into your plasma, then the final point is whatever this drug which is left, it has to be eliminated. So it can be eliminated through urine via kidney, feces through the rectum, milk or sweat through your different glands, and through air, that is through your lungs. So this actually chart what you see in front of you is nothing but the administration chart, where what are the various modes of administration, where does it get absorbed, and what are the various elimination which takes place. I'll be making another video where I'll be discussing in detail about all the administrations and how does it take place, what are the pros and cons of all these administrations, what is there. Today we are going to see what exactly is absorption. So once you have administered the drug, then the next step is your absorption step. Absorption step is nothing but the passage of the compound, okay, from the site of the administration. So after it has been administered, so you see this drug here, so there's 100% dosage which is there in this drug. It enters inside your body, it goes into your stomach, it then still remains to be 100%. And once it goes inside, then the first place where it actually goes is in your small intestine. Okay, in your small intestine, this drug, which is 100%, of which about 70% is lost, and 30%, because it takes the entire process, and then 30% is then enters inside the liver. Basically it enters inside this liver. How, and that is because of this cytochrome P 3A4. What is the significance of CYP3A4 and PGP is what I'll be making another video specifically related to this, where I'll explain you much more details of how these both play an action in your drug absorption. So 30% is retained here. Then afterwards, if you see, then this 30%, which is there inside your hepatocyte, which is there in this liver, out of it again 13% remains, and then this 13% of the drug, it actually goes to your site of action. So this is how the passage of the compound is actually what is taking place. All right, so it is the passage of compound is from the site of administration into the bloodstream or the lymph, and then which goes across the membrane. So hopefully you understand how the passage of this 100% dosage, it goes through your intestine, the small intestine, and then into your liver. Okay, so very frankly, a very small percentage of actually drug is left when it enters inside, when it has to go to your site. Now when I'm talking about the drug here, I am actually not talking about the molecules or the components of the drug. I'm talking about the entire drug itself. Now I won't be going into the details of how a drug is, but there are a lot of coatings around the drug. Okay, so as it goes, the lot of coatings which is there to protect it from the acids and everything, those get dissolved, and finally what remains is your actual drug molecules. Okay, so what I'm talking about, these 13 the 15% what is left is, I said 13%, sorry, the 15% what is left, which I'm talking about, is nothing but your final drug molecules, which is going to go and directly attack your disease foreign bodies which is there. So yeah, this is one which you must have seen in the last session, but this is your AUC, or the area under the curve. This is where the absorption phase is. So this is actually the place where the absorption of the drugs takes place. This is your maximum concentration, the maximum point where your concentration of the drug is. So here is nothing but your T max, or the time max. And then finally comes down is the elimination phase. So this is where the elimination of the drug starts happening till the concentration is the minimalistic. All right. So how does this affect for different drugs? Like sometimes if you see that when you take a tablet, they say that when you take a tablet, it's going to take about 15 minutes to kick in, or it's going to take about half an hour for the drug to actually show its effect, or sometimes like a painkiller or something, it takes about 45 minutes for the effect to actually show. What actually this means is that the for the effect to actually show, this is so that 45-minute mark, or that 15-minute mark, or that 1 hour mark is actually your Cmax. Okay, so this is that point where actually the drug has started showing its effect. Like suppose you take a painkiller, and after 45 minutes or half an hour, your the pain starts subsiding to a point where you feel no pain. That is the point of the Cmax here. And then after it has retained a Cmax, then it keeps on decreasing. Now this decreasing, or this elimination phase, can take a long time. So a painkiller generally is about, they say that you have to mostly take one painkiller in a day, or if it's very bad, something like a dental problem, then you have to take two painkillers in a day, because your elimination phase, because the pain is so intense that even if it reaches at this point, then the pain starts kicking in. So that's how it is. That really does not mean that the elimination phase is fast, huh? Okay, let me tell you this. If after like 6-7 hours your pain comes back again, that does not mean that your drug is ineffective. No. That means it is going down the elimination phase, but the pain which is causing to it is so intense that it is overpowering whatever this thing is. That is when you take it 2-3 times. Okay, the drug concentration also increases, and that decreases your pain what is there. Or basically your painkiller is nothing but it's attacking your nervous system, or it's shunning or shunting your nervous system. That's how it actually works. So hopefully you understand how this actually diagram of AUC or absorption is. I'll take one more example. If you're considering, let us say, your intravenous injections, okay, that happens quick. All right, or even when in the operations when they give those anesthesia, it happens quick. All right, that is because it is intravenous, so it is directly goes into your plasma, so there is no this big hassle of getting inside your stomach, then getting inside your intestine, then going into your liver, and then going into your blood. So this is what this graph is all about. This is your absorption phase, this is your max concentration, and this is where your elimination phase actually starts. So this is your AUC or area under the curve for your absorption. So this is the time which is taken and the concentration of the drug which is there in your plasma. So what exactly are the rate limiting steps for the oral absorption to take place? The first thing is your disintegration time and dissolution time. Now, what actually it means is when you have this dosage form, that is your tablet, which you are taking in, it disintegrates to form granules, which then disintegrates to form your fine particles. Now, this time of disintegrating from granules to fine particles, how much time does it take? And after that, all of these things get dissolved to form a solution. Now, this mostly happens in your stomach or near your intestine, because you take the drug as it is, and or the tablet as it is, and then you take it orally. Yes, there are in some cases where the tablet is actually supposed to be mixed with water, and then you take it in cases like this, your disintegration time decreases a little bit. In something like a syrup where you're directly taking the solution, so this all step is eliminated, but you're directly taking the solution, here your disintegration time decreases much more. Okay, but so that means your Cmax will increase very fast because your solution is more. But the only problems in cases such as this will be the number of times or the number of concentration of the drugs which you will have to give it will increase. Okay, like a tablet once in a day or twice in a day can work, but for something like a syrup you will have to take 3 times in a day or 4 times in a day, because of, now depending on what we are talking about, I'm not it's pretty general statement. Okay, it will definitely vary if you're looking at what specific you're working on, but something as basic as a cough syrup, you need to take it like 3-4 times a day. Okay, not more than that, but 3-4 times a day, so that you increase the AUC curve C max, just to make it stable. The second is movement to the membranes. That can be a limiting step, because for perfusion and for permeability reasons, because it takes time for the permeability or the drug to actually pass through your membranes. So that is again one more time which is there. Then you have gastric emptying and your intestinal transit. That is your stomach, and passing of these drug molecules through your intestinal villi into your liver. And last is your metabolism. How fast does your metabolism work? In adults, or in especially in young ones or in adults, your metabolism is fast. As your age keeps on increasing, your metabolism decreases, and that is why you see for any drug to take effect in old age it takes a lot of time, but in young people it is really very fast, because of this very main point, is because the metabolism in the drug is actually very fast. So these four are the limiting steps for carrying for your oral absorption. Okay, to take a lot of time till we reach the C max actually. So there are basically two types of diffusions. You can have a passive diffusion and you can have a active diffusion. Now, active diffusion or your active transport is this. where with the help of energy or ATP, you have the transfer of molecules which is taking place across the membrane. Okay, so you need energy here or ATP here in order for the transfer to take place. Something like your passive diffusion. Passive diffusion most mainly depends on basically the concentration gradient. Okay, so all of you know that the diffusion always takes from a high concentration to a lower concentration. So in this case, you have this 2, which is your passive diffusion, and you have 3, which is your diffusion, and 4 is your facilitated diffusion. So the only difference is basically on what in here you're using something to get transferred. Here it takes place directly through your membrane. So like this, there are two major types. So when we are talking about absorption, it is very important to understand what's both these things, your active as well as passive diffusion, play a very critical role when it comes to the absorption of your drug molecules from the outside of the membrane to your inside to your inner membrane basically. Okay, so this is your passive and active diffusion. The next concept which is important in your absorption is something what we call as bioavailability. Okay, so bioavailability basically refers to the rate or and the extent of the absorption of the drug. So again, we are looking at this curve. This curve is nothing but your AUC curve or your area under the curve. So your bioavailability refers to the rate and the extent of the absorption of the drug. Now this is your curve which you must have seen multiple times. So this is your AUC curve or area under the curve. Your bioavailability here is your F. Now what actually it means is how much drug have you taken in and how much drug has been absorbed. So something like if you take about 100 mg of drug has been taken in, but the absorption is, let us say, about 80% has been absorbed out of this 100%. Okay, then your bioavailability or your F is 0.8. Okay, so there are various factors in order to check how a bioavailability works, but this is how basically it's calculated. There's nothing but the fraction which tells us how much has been administered, which you can see here, and how much has been systematically absorbed and circulated into the system. That measures your bioavailability. And what is most important for checking your bioavailability is this same thing, is to check how much the extent of the absorption of the drug takes place. The more the extent of the absorption of the drug, the much better it is. All right, the less, then means it's not that effective, so then you have to increase the number of doses which is given to a patient. Okay, so this is another one of the important concept in your absorption, which is your bioavailability. Factors which are affecting the absorption, your first would be the drug properties. So your lipid solubility, molecular weight, polarity, etc. These are the various drug properties, okay, which can affect whether a drug can be absorbed into your intestine. Second is the blood flow. This is very important, okay, because if more the flow of the blood, much better will be your absorption which will take place. Next is your total surface area, which is available for absorption. Now, this is important when we are talking about your about the area which is specific. So that which is this one, your special affinity with the special tissue, or your area specific region where the drug has to be targeted. So, if more the surface area, the better chances of the absorption it is. If it is smaller the surface area, it will take a lot much time for the drug to actually show its effect, or for the Cmax to reach basically. Then contact time at the absorption surface, this is also very important. If there is a less contact with the absorption surface, another problem what could happen is your drug getting absorbed in your target site or a specific tissue site will be less. So something which could happen very fast, it will take a lot of, it will take in intervals of time to actually get absorbed. Okay, so that's why the contact time should be high. Then its affinity with the special tissue. The special tissue is nothing but your target tissue. And finally, and most important, is your route of administration. So how are you taking the drug? Okay, now there are various routes of administrations. There will be a video on that. Which I'll be posting. But so there are various routes of administration, and depending on how the drug is actually administered, your bioavailability or your absorption rate, which is that AUC curve, it increases, right? So this was your one of the event in your journey of the drug inside your body, which was absorption. In the next videos, we'll be looking at, okay, which is your distribution, metabolism, and excretion. Hopefully, you have understood how an absorption of the drug takes place inside the body.